In this episode of To Your Health series, we sit down with Dr. John Hogg of the Medical Vein Clinic. We get to learn a little bit about Dr. Hogg, what makes him such a special doctor, really, and as a human, as well as learning about a brand new discovery in medicine that could be the cause of your persistent pelvic pain, plus much more. Welcome to San Antonio Woman Podcast. This is To Your Health series, sponsored by Partners Real Estate. I'm Katie Goodman, the host, and we have our first ever guest, Dr. John Hogg from Medical Vein Clinic.
Thank you, Katie.
Yes, thank you so much for joining us. We are just so happy to have you because you have such a unique story and background. You help so many people here in San Antonio. So just a little bit, about you, what you do, what your clinic does.
Well, we are helping patients with their legs. It could be venous, lymphatics, arteries. We're just trying to get the legs in their best possible condition. So we do a thorough examination and we work to try to work with the patient to get them the best they can be.
You have such a beautiful office. I've been in there whenever you had your grand opening, and it doesn't really feel like a medical clinic. There's art, real art, not the kind from like
Yeah.
Hobby Lobby or, like a hotel. It's real art, and it's a great vibe. So, what kind of inspired the space?
Well, thank you. Well, I've been in medicine a long time,
Yeah.
and I'm just 25, but but anyway, I wanted to have patients have the best experience.
Mhm.
And, I didn't want them to feel like you're going to a hospital or something like that. I want them to feel like they're on vacation.
Nice.
And I think when one is relaxed,
Mhm.
the patients, they understand more, they absorb more,
Mhm.
and we get more information from them. And that helps us help that patient better. So I want to be very relaxing, open. And I come from a background, my mother taught art and is an artist, and her grandmother was a fine china painter back in the 40s and 50s. And so I grew up with a lot of art. So I love that.
Okay, okay. And another thing I remember from your grand opening is that you had hand squeezed the lemonade from the tree, lemon trees in your backyard. It's not
Yeah.
often that you hear of a doctor also being so grounded in that way. It seems like that life balance is so hard to find for doctors, but it seems
Well,
like you've
it's
kind of found some of that.
fun, and yeah, and I wanted, we did a little specialty drink, and it had lemon, and I grow lemon trees. They're organic and
Yeah,
had all these lemons. I thought, that's what I'm gonna do, and so I
yeah.
got those, and I stayed up and squeezed them fresh, and little things make a difference, and I want the best experience for the patients, be it grand opening or their visit to the clinic as a patient.
Yeah, and speaking of keeping your space very spa-like, I'm sure
Mhm.
stress has a big effect on a lot of the problems that you treat.
It
Is
it
that
does, in
yeah.
fact. And patients may come in, they've had their legs aren't feeling good, they're not feeling good,
Yeah.
and everybody has stressors in their life. Maybe it was a car that broke down or a sick family member.
Mm,
And so my job really is to help that patient, feel like they're relaxed, they're at home, they're welcomed. And when we do that, we can really reach that patient. We can really find out what's going on and what those symptoms are and how we can help them.
yeah, and so just talk a little bit about your philosophy of treating patients, expand a little bit there. Yeah.
Sure. Well, I think, I would want to be treated, with the best. And, my
Yeah.
mom comes in, I want her to have the best. And I want my patients to be like that. I
Sure.
want them to have the best experience. And it's not only the environment, you want it to be pristine. We keep it super clean. In fact, we have 3 full-time housekeepers there that are wonderful. And they keep a white floor spotless.
Yeah.
And
That's
it's
hard to do.
important. It's hard to do. I couldn't do it, but we have a great team, and so it's important that they have that great experience all the way through. And equipment, you could do things. And this is when I decided to do this. I wasn't going to do it on the cheapest way, try to make the most money. I wanted the best. And it comes with imaging. I've been an imager for a long time and I want the best equipment. Our ultrasound machines are crazy good. They're specially built hardware and software, and it makes a huge difference. I can see 256 shades of gray. Most humans do,
Wow.
16 shades, but it's
Wow.
training. Just like if you were trained being a concert pianist, you could do lots of things other people can do. Well, my
Yeah.
eyes are it. And so I wanted the machines that could show
Okay.
the most. And with that, we're seeing tiny little nerves, all sorts of things most people don't even know about in the profession.
Yeah, that's I mean, I read somewhere where you had traveled for 3 years to different treatment
That's
centers,
right.
just studying and researching, so that shows within all the equipment and the quality and the status
Yeah.
of care that you provide.
Well, thank you. It does make a difference. You always want the best. I
Mhm.
have learned that, and I didn't invent that, but I learned that through my years in the places that had the best equipment, and that includes the best people, best trained. You want to spend time working with each of your team members and
Yeah,
letting them learn the best, but you're going to have better outcomes, and that's what you want. That's why we do it. We want the
yeah.
best of outcomes to help people.
You had mentioned your mom. Is
Mhm.
that your why for becoming a doctor? And then what was your why going even in further into the vein specialty?
Good question. Well, I came from a long line of people that took care of people, a pharmacist, and my grandfather was a pharmacist, my great uncle. And so, small town, we took care of people. It didn't matter if it was a holiday or what it was, we would get in that truck and go to the store and open up and get them the medicine they need. And we always, it was very important. And you saw how that helped people. So I kind of got ingrained with that. Helping people is important and it's rewarding. You feel good about it. And so one day I was at a hospital, major hospital, and the administrator said, "Dr. Hogg, do you mind if I ask you a personal question?" I looked around, nobody was in there. I said, "No, please." And she walks around her desk and leans against it and she pulls up her silk pants leg and says, "I have this ulcer." Of course, it's about the size of an avocado, this hole in her leg, this beautiful woman who's the head of all these hospital chain. And she said, "I'm going to wound care twice a week and it's very expensive and I don't see it's getting better. I've told my cardiologist, it's a problem, and my dermatologist and a surgeon." And she named all these doctors and she said, "It's not getting any better." And she says, "I think it has something to do with this big vein on my leg." And she shows me this big bulging varicose vein about the size of your thumb.
Oh,
It's like, and I knew instantly this is venous insufficiency, and it's been holding the old blood down there, which starves the oxygen to the area, and her skin has died. And until that is fixed, you've got to, solve the problem, and that would be how to heal it. And I thought, here she is. She has every doctor at 20 something hospitals at her beck and call, and they're not figuring it out, they're not addressing it. There's a calling there. And I thought, this is my mission. I need to do that. And so I set out and realized venous insufficiency, that's what we call it when you have the bad veins causing leg problems. I thought, I really need to do this. And so I set out and went around the country. For 3 years, I took every vacation day I had and I would go and visit. And that's what I wanted to see, what they were doing around there. And learned a lot and I saw a lot, but most things were just done as a second thought. It was
yeah.
kind of a sideline, cheaply done. I thought, I know equipment and this could be done better. And so that became my mission. I wanted to educate providers, physicians, PAs, NPs, about this disease so they could see it in their patients and figure out how we could help them.
Wow. That
Yeah.
I'm just first off dumbstruck by the fact that you did that on your own time with PTO. It wasn't some program you were part of. I mean, a
No.
lot of people they need that excuse to go deeper, but you really went outside the box to become the best you could be. And, as someone who I have an elderly father, so we see a lot of doctors and we see sometimes people
Hmm.
not really going above and beyond or really digging deep. And it sounds like that's what you're driven by is really the details and
It
uncovering
is so
things.
important to really, you
Wow.
just, I'm not going to be a jack of all trades, but I'm going to be the best at what I'm doing. And that's so important. And part of my mission, not only in treating, but educating people. I mean, you think about your legs, they felt like they did yesterday and the day before, and you can't remember anything differently. But, when you're having venous insufficiency or you're having lymphedema, it just gets a tiny bit worse every day, and you don't notice that gradual thing. If
Yeah.
you had a sore throat or a headache, you'd know it right away.
Right.
But these things that are very subtle, that people don't notice that. So it's important that we bring it to their attention. And thank you for the magazine for bringing that to people's
Yeah,
attention. I mean,
yeah,
our legs, this is our transportation. This is
yeah.
what's going to take you places, and you want them to last and be healthy.
For those of you who don't know, Dr. Hogg is a regular contributor for our magazine, but he's
Thank
also
you.
on TV from Austin to San Antonio. Your opinion is really, truly
Well,
respected across
well,
Texas.
thank you. As they say, there's a little ham in every hog. So
Well, you're the perfect amount of ham and honey. I love it, Dr. Hogg. You're just the
thank
coolest.
you.
But yeah, so, with all of that being said, um, most people when they come to the medical vein
Hmm.
clinic, they're thinking, well, at least as a woman, I'm thinking varicose veins and maybe some vanity stuff, or
Yeah,
as you're getting older, it's circulation issues. But something maybe that's not talked about as much is pelvic pain. And from what I understand, you guys have some new information or technology on
exactly.
pelvic pain. So could you just expand on that a little bit?
Certainly.
Yeah.
Well, it's very exciting, the things that we're finding out about pelvic pain. Certainly, if somebody has little spider veins, I try to get patients to think beyond that. What caused that? And so
Hmm.
we're searching for the veins that cause the problems. And when we stop that, then when they go back and treat the spider veins, they have something that lasts. And so they've had the pelvic pain a lot of times. And this is one thing that I've had friends of mine, some girlfriends that they've suffered with this for a long time, and they've had, they'll come and tell me, maybe it's, when they're having intercourse that they have pain either before or
Hmm.
after, and they maybe talk to their doctor and they think they're crazy or their spouse and it's just been a problem, or they're just having pain, and their, menstrual cycle seems worse than their friends. Sometimes it's back pain. They may be having, this is something that I've seen, not uncommonly. They'll have GI problems and they'll
Hmm.
maybe have intermittent diarrhea or constipation
Wow.
and all of these things. And they'll go and some of them, poor things, they've had all kinds of bowel surgery and it's not better. And
Yeah.
now, as we're finding out, a lot of the symptoms from the back pain, the GI, from the, painful things in their pelvis is coming from varicose veins inside the pelvis
Wow.
that are really have gone undetected and untreated. And so now we're able to do evaluation and look and see if we can find that. And just like how it would bulge and big, out in your legs, sometimes you see them up in here, sometimes they're internal and you don't, and you're getting that secondary effect. But those are
Mm,
things that we can come in and treat that and make that go away. And it is amazing.
that's
Yeah,
incredible.
80% of the women that have this treated, it's their symptoms are s- diminished or gone in 2 weeks. It's
Wow.
just amazing to think they've suffered for a long time. And I just want people to know, we're listening and we believe you and we know this can be a real problem and
I
we want to find out what does it.
I was just gonna say, a lot of the female plight with
Mm-hmm.
doctors is you go in, you have all these symptoms. They give you anything from hormones
Yeah.
to, vaginal issues to GI,
Mm-hmm.
like you said. And now there's this other issue that it could be the vein stuff. I'm sorry, I'm obviously not the technical
No, that
doctor here,
the vein
but
stuff works
yeah,
fine. I know
yeah.
what you're talking
Yeah,
about.
yeah. But
Yeah.
what I'm trying to say is I'm sure there's a lot of people out there who probably find relief to hear that because there's probably
Yeah.
a lot of women who have been to doctors and they haven't gotten the answers like you had said. And now there's another option for
Well,
what could be explaining their pain and symptoms.
exactly. Well, that's why we're here and we listen. And we want to know what's going on. And when they tell me these things, I try putting it and I'm thinking outside the box. And it's really in an area that your PCP is not going to be specialized in that. And even your OBGYN, a lot of times they're having these problems and it's not something they really understand or know how to treat. They do the routine things like you saying,
Mhm.
things don't get better. But now we can image inside the pelvis and we can see and find these varicosities and treat them. And that's just huge. Life changing.
I was going to ask, symptoms that didn't seem linked or unexpected, but it seems like the entire nature of, you call it PVC? Is that what you call it?
Yes,
Pelvic
pelvic
vein?
venous disorder.
Okay, pelvic venous
Mhm.
disorder. So within this entire disorder, I feel like the nature of it is a little bit unusual, right? Like,
It is, and full disclosure, I mean, this is something that's very evolving in technology.
mhm,
A lot of what, just like with the veins in the legs, years ago they used to do vein stripping and surgeries, and we don't do that anymore.
yeah.
And the pelvic things were just totally ignored. They didn't really understand, but now we have techniques without surgery. We can go in just little tiny catheters, and we can open those veins up, or if they need to be closed, whatever, and we fix those problems. So, but it's a fairly new technology, and we have Dr. Giannis, board certified vascular surgeon, and it's great. He's been around the country studying, traveling with this, and it's wonderful that we have that to offer for the women in San Antonio.
So most of the treatment then for this would be with that technology. Is there
That's exactly right.
medication? Is there lifestyle changes? Is there anything
With
else that
some things, there's more lifestyle changes, but with this, a lot of it is we do imaging first
mhm.
and find out and diagnose that that is the problem. And then when we see it, we go in with a little catheter, and where it's bulging out, they figure they can fix that, and they resume their normal lives afterwards.
Is there anything that would be a telltale sign for a woman, say that, maybe she's having all of these problems you're describing, but how would
Mhm.
she know it's maybe not hormones or it's not GI, maybe that it is this? Is it just a trial by error, process of
Sometimes it's a
elimination?
process of elimination, but if we're seeing multiple of these symptoms, maybe they have varicosities and they're having, dyspareunia, the painful intercourse, or after, or standing up. A lot of times, we had an athlete coming in, and she was super fit, and she's just saying, they can't figure this out, but I'm competitive cyclist, and
Mhm.
she says, but I can't go as far. I have to stop because I keep getting this pelvic pain. And sure enough, that's what she had. But so it's sometimes we don't know exactly what it's going to be from, but through a process of elimination or just investigation, we can figure it out.
Are there any other ailments associated in tandem with it? Sometimes if a person has one ailment, they have other ailments or comorbidities, I believe they refer to them as.
Well, with the pelvic venous
Mhm.
disorder, like I said, they may have all sorts of bowel issues. It could be intermittent diarrhea, constipation. Low back pain is surprising.
Yeah.
They'll feel that pain because when those veins get engorged, they can be painful.
Mm.
They may see varicosities. So there are lots of things, but the most common thing in that is the pelvic pain.
Okay. Okay. Wow. And could it at any point be life-threatening?
Well,
I mean,
bulging
I'm sure
veins,
you're already uncomfortable
yeah.
as it is, right? Which is
Sure. And
life-changing, but
usually
life-threatening?
that is not life-threatening per se,
Mhm.
but anytime there's an enlarged vein, the blood is moving slowly in it, and slow moving blood tends to clot. And of course, a blood clot anywhere is a dangerous thing. So, it could be remotely. We tend to see more of that in the legs,
Mhm.
but they can mobilize whatever. The ones in the pelvic, I haven't seen, life-threatening complications from that, but it's just not a good thing.
Right, right. Well, you know who to go to if you are having any of these symptoms. I mean, this
Sure.
is news to me. I had no idea that, vein issues could cause all of these other symptoms. So I've talked to, I can't tell you how many women I've talked to who have mystery illnesses or issues
It
and they
is
just don't know what
amazing.
to do or they
Yes.
feel like they're not being heard. So it sounds like this is a good
And so
place.
that's part of, I'm always listening with my friends, family, whoever it is. I'm
Mhm.
listening to things out there and complaints. And one of the ones that got me so interested in that particular aspect were, some of my friends that have had all these pelvic problems and pain, and they've had surgery after surgery, and it's just not getting better. And their doctors are thinking they're crazy. I'm like, no, it's not. And so then you find out
Yeah.
it is this pelvic venous
Wow.
disorder.
Wow. Wow. Well, great thing is the more and more research that comes out for women, the
Yes.
better it allows us to
It is.
solve
And for
problems.
you, thank you for bringing it to everyone's
Yeah.
attention, because I bet most people out there listening didn't know about it.
Yeah.
And most of the ladies they're like, oh my gosh, that's my sister, or
Yeah.
I've had that or something, So it's so important. Thank you with your magazine. You're bringing lots of things through your
Mhm.
health issues to light, and that's so
Yeah.
important. All these little things, and I hope everyone listens
Mhm.
and they can help friends also.
Yeah, and if you have more questions, if you're experiencing these kinds of symptoms, you can reach out to Dr. Hogg and his team. They're incredible. I can vouch for them. Great people. Medicalveinclinic.com. They also have a ton of social media links that you can go to. Lots of great information out there. A YouTube, and 2 locations. This brand new, beautiful one here in Stone Oak.
Thank
If
you.
you're watching on YouTube, we've got the address and phone number there on the screen. If you're listening, just go to medicalveinclinic.com. It has all the information that you need there. But thank you so
Thank
much,
you.
Dr.
Thank
Hogg.
you,
It's been
Katie.
an honor.
Well,
Let's cheers
yes,
to your
I'm
health
going to toast with this
podcast.
water, i.e. vodka.
Yes, because we are healthy out here, okay? This is
That's
a
right.
healthy podcast.
Thank you.
Thank you.